In a world where everyone seeks the loudest cure, homeopathy whispers the truth, gentle, precise, individualized. Good afternoon to all present here. I, Dr. Abhishek Karmakar, third year PCT, feel truly honored and humbled to welcome you all to today's academic gathering centered on an intellectually enriching session titled Exploring New Horizons of Homeopathy, Unknown Medicines in Known Conditions, and the Application of Lesser Known Remedies in Homeopathic Practice. We are honored to have among us respected teachers, renowned practitioners, dedicated researchers, and young homeopaths breathing with curiosity and purpose. The world of homeopathy is a vast ocean where, even after more than 2 centuries, new pearls are still being discovered. While we are familiar with the polytrates, today's discussion takes us into the uncharted territory of unknown and lesser known yet equally potent remedies. Often hidden in the shadows of the giant, these rare remedies hold immense potential when used with precision, especially in cases where the well known remedies fail or do not cover the peculiar individuality of the case. This is not a session, this is a journey where we look beyond the obvious, question the limit of our medica usage, and discover the unseen treasures hidden in the pages of our lesson known remedies. Let us now start the session with garlanding Master Hanimal and evoke the light of wisdom and clarity. I humbly request our dignitaries to step forward for the lighting the ceremonial lamp, symbolizing the triumph over knowledge of ignorance and light over darkness. Please, sister. I would like to invite all the dignitaries to come forward for the lamp lighting ceremony and garlanding of Master Samuel. Thank you for gracing this moment with your presence. And now, the most awaited part of the program. It is my profound privilege and honor to introduce a towering figure in modern homeopathy, someone who has not only practiced the art with mastery but lived its philosophy with passion. Dr. Sunirmal Sarkar. Dr. Sarkar is a name that resonates across the globe in homeopathic circles. He is a world-renowned clinician, teacher, and thinker whose dedication to treating the most difficult and seemingly incurable cases has earned him admiration worldwide. With over 3 decades of clinical excellence, Dr. Sarkar is known for his precise and evidence-based clinical approach, structured and logical case-taking methodology, sharp interpretation of medica, and deep understanding of pathology correlation. A rare blend of classical homeopathic philosophy with contemporary clinical insight. He is the author of several landmark books like Just You See, Concentrated Materia Medica, cracked mind, healed mind, structured homeopathy, etc. His academic excellence and fearless clinical experiment with less and known remedies in seemingly hopeless conditions have earned him national and international acclaim. Above all, Dr. Sarkar is admired for his humility, simplicity, and clarity. Qualities that continue to inspire thousands of homeopaths around the world, including myself. With great respect and heartfelt anticipation, I now invite Dr. Sunirmal Sarkar sir to kindly deliver his keynote. Please, sir, come on the dais.
Respected principal, learned faculty members, my beloved students. Title itself, I think something puzzling me. That unknown medicine. Honestly speaking, even after practicing more than 50 years, still I don't know aconite fully. Because learning is a continuous process, and those who are practicing, they know that how difficult practice is. Theoretically, we can cure lots of patients, but handling patient is something art and application of knowledge. It is always you have to sharpen your instrument, that is the mental faculty and the five senses to become successful prescriber. Why I am telling aconite, still I think some, yes, DNDH students are also there that time it happened. A lady came, lady means I think 30, 31 years old, suffering from amenorrhea for more than 4 years. And all sorts of hormonal treatment it fails. And when we are taking the case, we are able to find out that actually during midnight, she went for urination, and that time a cat make a noise, and he was shocked like anything, unconscious for few minutes. Then he gained everything, and after that, no menstruation. And I think yes, I know at least 2 3 doctors are there. We prescribe a medicine in 50 m, and my bathroom is only 1 minute away. As soon as we give the medicine on her tongue, within a moment she develops something is coming out, and menstruation develops. It is not story. It happened. It facts. We may not be able to analyze with theory, but fact remains fact. Facts remain fact. And theory changes very frequently, but fact it will persist. And definitely someone is smiling because that time we have no napkin or in our clinic, but ultimately somehow she able to purchase napkins. Menstruation are so slow it is. And the name of the medicine is aconite 50. How quickly homeopathy medicine can? No story, but you have to learn where and what to pick and how to use. And maximum you people are doing MD or the post graduation course. So you have enough scope to go through this type of application from ring guiding symptom, Kane's repertory, unusual application of the usual medicine also. Dear doctors, because it is totally clinical oriented, I will start even some medicine. How many of us we are using homeopathic medicine for thyroid problem? And have you ever seen the thyroid 130, 170, 210 PSA gradually is coming with homeopathy? No story. We have every case we have documented, because if we know the essence of materia medica, it is bound to act. It is bound to act. I am telling more than 200. More than 200 PSA is gradually coming on. Now let me. Any problem? I think it will. Okay. Doctor, lots of PowerPoints, but let us analyze from the books. That will be better choice. Okay. Any PGT have cured any PSAs with our medicine? More than 30, more than 50, more than 70? And any statistics? Because you have to participate, doctor. I never think. I have lots of seminar, more than 1,200 people. And I always try to keep them with me. Any idea? What medicine has acted mostly in case of thyroid problem, especially hypothyroidism? Because after hypothyroidism, lots of emotional trouble. It happens. Sweating, clamminess, emotional trauma, and other factors. Allergic rhinitis, hypertension, everything happens. Any idea? Huh? Please open your mouth, doctor. Then I so many medicines later on. Okay. Any idea regarding thyroid problem? We are not telling hundreds, but definitely so many cases of thyroid problem can be cured with our medicine. And every case I am telling, not every case, but 9 out of 10 you can confidently cure with thyroid problem. Thyroid problem with homeopathy medicine. Okay. Now let us see some symptoms of the mental symptoms, especially thyroid problem. Lots of emotional troubles develop. Is it not? Quite naturally, becoming flabby, extremely fearful, cannot stay alone, fearful in the dark. But maximum that the emotional trauma, that is especially anger leads to weeping. Okay. Anger leads to weeping. During sleep leads light. Without light cannot sleep. Okay. And another thing that is peculiar, generally weeping after anger. After anger leads to weeping. Doctor, if you take this day, I think yes, so many doctors they attended my clinic. They also love prescribing. Belladonna is the only medicine. Belladonna. Even 1 ml, 10 ml, 15 potency and pass for 2 months, 3 months, and we see the result. Especially, Doctor, this emotion. Respect the principle of science there with psychology. So I am telling little bit regarding this. Psychological trauma. Especially most probably, we should think in various ways. As a homeopath, how many trauma and how many rather resonance or response it will be after psychological trauma or mental trauma. And is it not that anger leads to weeping? Is it very funny thing? And in our materia medica, the repertory, those who have repertory, you can see Nux vomica, aconite, sorry, arnica, platina, and belladonna. These are the four medicines. Okay. These are the four medicines. And among these, belladonna. Doctor, if you know belladonna, at least I am telling you, 95% cases of thyroid problem can be solved with this medicine. But other symptoms you have to know. I think day before yesterday, not yesterday, day before yesterday in our clinic, some doctors are there. A person is coming for constipation and other problem. Is asked what? Try to understand that how to correlate clinical symptoms. Doctors have. I have spent 10,000 rupees for the allopathy doctor. She is showing some papers. And again, I have to give money for you. Very simple problem constipation. How this doctors in front of doctor, how the patient is telling the medicine. Name. That is, if you know the materia medica, ডাক্তার বাবু 10,000 টাকা খরচ করেছে, আবার আপনাকে এত টাকা দিতে হবে, 3,000 টাকা দিতে হবে। কিন্তু আমার তো কোনো সমস্যা নাই, পায়খানা হয় না। And other features are there. Can you give me, can dear doctors any medicine? Yes. Yes. Opium না? দেখো anxiety of extravagant. এই যে মূলবিদের একটা যে টাকাটা দিচ্ছি, এটা বাদ দিতে হবে। বাদ দিতে খরচ হচ্ছে। Try to understand materia medica in this way. মানে মূলবিদের তো টাকাটা দরকার নেই না? মূলবিদের doctors are taking fee. It is a judicial offense না? Criminal offense. So in which I can start. Next. So belladonna, doctor. Suppose yesterday night watching was there. I completed my clinic, then I come here. All on a sudden, I develop heart triangle and I fell down. Remember doctor, that of CPR cap, what I am telling, night watching. Night watching, followed by this heart triangle leading to syncopal attack. That is transient ischemic attack. Transient ischemic attack. What medicine we can think of? Just all on a sudden, heart triangle, syncopal attack. That is in practice of medicine, it is transient ischemic attack. You can give any medicine that one. Okuda. Okay. Please open body materia medica. Nux vomica. In Italy for this. Nothing I will tell on my own. Is it there? So whether it is unknown medicine or unknown application of the medicine, we don't. Or we are not applying. Actually our masters have applied very nicely. But the problem is that we really handle patient, really. And more you handle patient in reality, more you will know that how little we know. That is the problem. Like this, oily face. Very nice. We can think of. Is it not? Oily face, puja, natramute. These two medicines are Gamma metallicum. These are the medicines are there. Now oily face, one-sided perspiration. One-sided uncovered parts perspiration. One-sided uncovered part এবং oily. If you cover, which one will come? Again open body materia medica. Observation is a first. Is it there? Oily face. Because so many requests come that give some clinical tips. Doctor, clinical tips you have to observe among the patient. That is your depth of knowledge and correlate with the patient's behavior and materia medica knowledge. Because I am telling just that somebody is telling populous. Any idea that why we can prescribe populous in fever? You guide me and I will discuss the material. Not from my own. Any name of the medicine I will take, then I will discuss something. I will try to add something from repartee or populous fever. Number one, doctor, lots of allopathic medicine has taken place. Patient is actually become extremely irritable like Naxmovita. Irritable, cross, TB. With lots of medication followed by the neurological condition, vertigo, irritability. Along with that, the sneaky neurological, sneaky, that is going into depth, hiding that means going into deeper, and doctors become puzzled. What actually is happening? That is one thing. And those who have changed repertory is open. Nowadays, mobile, it is very difficult to control. This is not handling. Everybody is now playing with mobiles. Son is playing, wife is playing, father is playing. Everybody is absorbed in his own world. Just like autism. Autistic father, autistic child. Now, very often we have seen in our clinic that mother is complaining, give a good slap for going to school. He denied because yesterday night lots of play games, this and that. And after that, son developing fever. Fever due to anger. Maybe chamomilla, maybe stabicegria, but one medicine is there, copulus indicans. Open. Games repertory. Fever, anger from. Actually, then definitely with one symptom we will not prescribe because we have to differentiate with popular, aesthetic, establishing the policy and other symptoms. I don't know. Now, tell me that during fever, patient is not drinking water. That is thirstless during fever. Go through. Copulus is one of the medicine. Open, kids repertory. Okay, okay. এখন তো আমারই সার্ভার ডাউন করেনি next because we are using this way now is thirstless fever during copulus. Okay, now doctor, your responsibility just you ask one thing because child is talking coming just ask father, are you a smoker? Yes, give copulus. Cannot open boric materia medica. Throat symptom দেখো and smoke. Is it? इसमें आपण consider bacteria as irritated by smoke. Doctor, so they have never prescribe on one symptoms, but if you correlate now, definitely you can create your own material. You have to create. Then another thing, nowadays every metropolitan city become dignified old age home. Son is working somewhere, daughter married, husband died, or wife died, single person. 3 rooms, 4 rooms, and three student building only one person. Any problem of that person, if you ask, why not you are going to your mother, your son, or daughter, or somebody else, or বাবা সবই তো বুঝি কিন্তু কিছু করার সবই বুঝি I know everything but whatever the problem maybe with daughter-in-law or son-in-law or son himself or herself হ্যাঁ বাবা সবই বুঝি কিন্তু আমার কিছু করার নেই that is the keynote indication of popular indica in this type of geriatric problem. Recognize the situation in Kane's repertory. Recognize the situation, but unable to move. Is it, Doctor? What I am telling that I am not memorizing better because we are doing this practice every day. Because failure with us every day. At least I fail repeated. That much I can say. But from failure, we are trying to learn something regarding application of the materia medica. Because understanding everything but unable to do two medicines are there. One is populus and another is the immunity academics. Is it not? So different way we can think populus indica in different situation. Okay, different situation, and that is again populus. Doctor said, क्या होता है ना? Whenever I get angry, I develop pain in my liver region. Only medicine in Kane's repertory. Insult, as if insult, pain liver, as from anger, as from insult. The first thing should be think of populus. So different, so many ways, because unknown area have to be explored, and for this reason, after BHMS, MD or the PhD, different or the DM, na? It is gradually, the degrees are there, but better until and unless. Very good. Until and unless we explore it, it is very difficult to be a successful prescriber because success begets success. Now, why I am telling that different books you have to go through, not Allen, not Boric. Not even Allen's encyclopedia, not even Boric, your Herring's guiding symptoms, none is fully analyzed or published all the symptoms. Even Master Kane has criticized Herring's guiding symptoms that lot of symptoms have been omitted. In which drug he has criticized? Herring's that teamwork. Can you tell me? That during he is telling that these symptoms should be added in these symptoms, but due to lack of place, lack of rooms, Herring's that editorial board has omitted these symptoms. How many have gone through Kent's report, Kent's materia medica? Okay, please go through Apparatus chapter. There you will get that how many symptoms Hennings has omitted. Now, even other, the same thing has been omitted by Master Kent also. I'm giving one example. Doctor, nowadays, bladder outlet obstruction is very common nowadays. Very difficult to cure also. Doctors, any idea regarding this cystitis followed and this your bladder outlet obstruction? Any medicine we can think of pathologically? We have to coordinate everything to become a successful prescriber. Only mental symptoms is not enough. Any idea? Everybody become Gautam Buddha. Huh? It denotes that you know everything, nothing to pour in your brain, or something. What I am telling it is either superficial or beyond your head. Which one? I don't know. That neck muscle, bladder neck muscle, it has medicine affinity for the muscles of the neck of the bladder. Okay, let me discuss. This medicine, actually, it is really one of the medicine everybody should know to treat this case, this type of cases. I am telling a very small medicine. But I think in hearing it is really nice, very it described very nicely. Not in boric materia medica, not in Kate's repertory. Just please go through Ilaterium. Boric materia medica. Dear doctor, this is the medicine, tubercular medicine. Tell him, you know, I think few days ago also prescribed in our clinic. Huh? Okay. Yeah. Ilaterium. Huh? Urinary symptom. Violent vomiting, purging, and greenish diarrhea. Urticaria after malaria. Is it? After ডাক্তারবাবু intermittent fever কমে গেছে, urticaria শুরু হয়েছে. And not only that, urticaria better by rubbing. Doctor, only medicine in Kate's repertory. Better by rubbing. Elaterium. And next, yes, William Fever. Okay. Better by rubbing. Only Kate's repertory. Not in body. Allergy, better by rubbing. Then tubercular mentality, desire to roam, desire to travel, even during night. Mental symptom. But no urinary symptom. Okay? আচ্ছা ইউরিনে কিছু পাচ্ছেন আচ্ছা now please go through Open's Kate's repertory Elaterium. Urine. Urine, bladder, anything symptom? Any? Nothing is there. But not the this bladder outlet from yeah. Huh? Next, only thing. But let us see now open very guiding symptom. Let us then that convulsion due to it has a special affinity for the muscles of the neck. Huh?
Constant heat at the neck of bladder with extremely painful inflammation, inducing even convulsion.
And convulsion. So how much stiff the neck is, that to imagine. Okay. Now, so for this reason, you have to go through so many books. Why I am telling that one book, one repertory is not enough. Now, is it there? Parts materia medica, part PURT. Yes, express. Auditorium. He has shown 42 cases of this bladder outlet obstruction. 42 cases. Hmm. But we are not using. We are here, Salapsibar is there, Uvaus is there, Puja is there, cyclamin is there, sisters. So many medicines are there. But at least we should think this medicine, tubercular tendency, tubercular diathesis, traveling mentality. With this bladder outlet obstruction, one of the medicine is our Auditorium. Okay? Now, let us see some other medicines also. Common medicine, what uncommon use. That will be better. Doctor, nowadays we are treating lots of fellows who are suffering from mental trauma, from financial failure, business failure. Is it not? That after the financial failure, business loss, we have that my father has developed this, my brother has developed this, or wife is telling my son or my husband is developed this. Now, it is a common symptom of the Liliaceae family that business failure, either in dream or ailment. Dreams that business unable to accomplish. This is the first Liliaceae family is Sabadilla, the dream man. Dream ka Sabadilla. Dream business unable to complete. Okay, let me complete. Another medicine can you tell me ailments from business failure? Any other medicine you know? One is ambrosia in Allen's keynote, calibrome, is it not? Two are Alzheimer's, imaginary. But I am telling it is not imaginary. Okay? Calibrome not imaginary. But other medicine, that is the beauty that why you have to go through repertory or you have to go through PhD or the MD. After Allen, what more? That is your duty to explore that. It is a common phenomenon of the Liliaceae family that everybody is connected with business failure. Scavadilla, dream that I have failed in business. Mal, another Liliaceae family, ailments from business failure. And number three, mania, insanity after business failure. The medicine is Lilium tigrinum. So, apart from this, mania or insanity after business failure, Lilium tigrinum. Business failure. Accomplish, unable to accomplish business. Reference দেখাতে গেলে সময় চলে যাবে অনেকটা না মাঝে মাঝে। Now, doctors, at the common medicine I am telling that just imagine the cannot accomplish business Savadilla is there. Yeah, cannot accomplish business. আমার complete repertoire is there. Complete. Complete. ওটা হবে আছে। সব কিছুই আছে। আপনি কি জানো তো আমি বলছি যে we have to explore. কথাটা হচ্ছে কি যখন আমি ফেলিওর হচ্ছি তখন আইদার মানে fight or fly, either refer or fight. আমি বলছি এই টেনাসিটি থাকলেই everybody can do it, anybody can do better than anybody, but you should have some gene that I will do it. Somebody এবার একটা কথা বলে দেখ, একটা খুব একটা কমন মেডিসিন that you know that your father, mother, brother or a friend business failure, and for 6-7 days totally he became benign, একদম মানে কি বোতা হয়ে গেছে, কি হলো, what happened, and after 6 days or 7 days or after a week now he is thinking আমার টাকা আমার টাকা আমার টাকা আর্নিকা আর্নিকা আমরা দেখেছি, আমরা অনেকবার বহুবার প্রেসক্রিপশন করেছি আমাদের ক্লিনিকে। হ্যাঁ, লেটার আফটার রিয়েলাইজেশন অনেক দিলে, মানে হোমিওপ্যাথি ডাক্তারদের থেকেও মাথায় বুদ্ধি কম, হ্যাঁ, সেন্সেশন অনেক কম, হ্যাঁ, সেই জন্য একদম ডিলেড রিয়েলাইজেশন অফ দ্য মানিটারি কস্ট। এবার দেখি এই ডিলেড রিয়েলাইজেশন, এটা হচ্ছে মেন্টাল ট্রমা। নাও কারণ দেখো এই মেন্টাল ট্রমা নিয়ে আমি খানিকটা বলবো, কারণ এগুলোতে কতভাবে নতুন নতুন মেডিসিন এক্সপ্লোর হয়ে যায়। দিস মেডিসিন ইজ এ ইন বিটুইন ব্রায়োনিয়া অ্যান্ড ইগনেশিয়া। ভালো করে শোনো বাবারা, not for the teachers, those who are there, because they know I believe it, and definitely they know more than me because they are now young stars. They have more time and energy to go through material. This is in between bryonia and ignatia, and sometimes instead of ignatia, the writer is telling, I prefer this medicine. প্রথমটাই কি হচ্ছে, suppose in your clinic, I'm giving a good examples because very frequently it is a polycrest medicine for us after mental trauma. Tell me some your personal life, some problems are there. Yes, I was married. Or I am married, whatever it is. Then a pause. Because nobody is willing to tell his or her, especially her mental trauma, psychological trauma, possible. Ignition. Okay? Then I was cheated. I was cheated. একদম ওপেনলি বলে দিচ্ছে, হ্যাঁ, I was cheated. Now hot, cloudy ailments from this cheating, deception, ailments of deception, and extremely that lady, an arrogant lady, Clark has described very nicely. যে কতগুলো অ্যাডজেক্টিভ দিয়েছে, সেই অ্যাডজেক্টিভ গুলো ডেফিনেটলি আমি বলবো কি করতে। প্লিজ ওপেন ডিজিটালি Clark Dictionary. We are not using digitalis in mental aspect very frequently, but it should be today's medicine. Every alternate day you have to get this type of ladies, especially IT sector ladies nowadays. Then the ladies, those who are staying alone in Bangalore and other places, কি কি মেডিসিন লেখা রয়েছে প্রথমে ইন্ট্রোডাকশন। দেখো these two classes digitally certified in sleep insomnia, sleeplessness. Nowadays everything you will get doctors, everything. Such as unhappy love, ওইটা বলতেছিলাম, unhappy love. সেই জন্য যে cheated, I was deceived. Ailments of deceit. One of the medicine is digital deceit. Unhappy love. লাভ করতে গিয়ে লোকসান হয়ে গেছে। Especially women of brown complexion, firm and obstinate ব্রায়োনিয়া তার সঙ্গে ঠিক আছে। Mathematics is very easy. Take it simple, utilize it in your real life, and you will be a successful prescriber. And mistake is with everybody. And from mistake is not at all a mistake. Mistake is mistake when you don't learn anything from your mistake. Everybody is doing mistake. Who not? Unbelievable cases you will do in this way. It is a everyday medicine, especially for the IT sector, women's lady, or those who are married first time, second time, third time, fourth time, whatever it is. And nowadays, stay together, get together, live together. Okay? Think for digitalist. And digitalist clock, what he has done, only 3 symptoms is there. Only hypersensitive liver, white color stool, and pulse irregular. Nothing else, nothing else written. But how he has described this. This is the way you have to learn materia medica, doctors. I know some of you are better prescriber. I know. But every day we have to practice. Make it more sharpened. That is the only way that we will be the successful prescriber. Now, another thing digital is for male. Doctor, any sexual indulgence leading to whatever the symptoms in your materia medica, if you are able to describe, digital is on this. Palpitation, indigestion, loose stool, headache, vertigo, insomnia, go through. Male symptoms of digital is from Games repertory. Games repertory. Male symptoms, sir? Male. What not? I think 11 or 12 symptoms are there, but we are always prescribing stabiciclib. Is it not? Or noxobomica. The digital is digital. Yeah, digital. Digital is male. Brother, even go through very nicely, they better in NAR repertory. NAR repertory is a very systematic, it is written. NAR. NAR. Unique deal of all you do. Chapter select all do. No, sir, not no. Don't do. বলে যাও হ্যাঁ ঠিকই আছে দেখো এক্সেসিভ এক্সেসিভ বলে কথা আছে কয়েকটা বা ঠিকই আছে
Caution after emission nightly for 8 or 12 nights. Genital swollen, toxical, genitals weakness, prostate in troubles, pain, emission after swollen, cardiac dropsy, penis swollen, cardiac dropsy, prepuce fibrosis, burning, weak, on urinating, scrotum swollen, bladder looks like a filled with water, scrotum swelling, dropsy, cardiac,
excess
the sexual excess caution, appetite loss of sexual excess caution, digestion impaired, sexual excess caution, dyspnea at night. From all sexual excess, caution, ears ringing in, caution, emission,
ringing in the ear, dim vision, palpitation, what not. But doctors, how many of us are using digitally? We are prescribing. Not what establishing real, but we have to explore more and more. No, actually, that also that if every medicine has its own field, that is taking. But doctors, what I'm trying to present in front of you, and some of you know, I know, So many homeopathy doctors say they are better prescribers than me also. I appreciate them. But if we conjointly did something, that I'm taking from the beginning, it is not it is not I, rather we. That can save homeopathy in a better way. Deve or neve. You have to take and you have to give digitally. Matter how nicely it is written, and definitely if slow pulse, 40, 45 is there, and cardiac problem was there, stent was there, stenting, we can think of digitalis because digitalis is the medicine, enlarged prostate with lascivious drugs. Only medicine in our case repertory is digitalis. Okay? So it has a special affinity. So now this slow pulse, and patient is telling that doctor, I am suffering from polyarthritis. I am treated by so many doctors, whatever it is. And when you are asking, that is migratory polyarthritis. Today here, next day here, next day here, next day here, polyarthritis, and it has no pattern. If it is left to right, we can think of lactis agaricum. If it is right to left, we can think of belladonna or the lycopodium, upward to downward, lead down, and upper to downward, hypericum, upper to downward, plumber metallicum, upper to downward, ponium metallicum. So many medicines are there. But it has no pattern. But the count in the pulse is very slow pulse. And Bodhi has told very nicely that most curative in migratory rheumatism, most curative, here's what the word curative, open apsina mandro. Body apsina mandro. Highly curative. We are doctors, but how many homeopaths are using this medicine? But body has written in premise, not a single word I have used in my book that which is not clinically verified. Okay. And body has used another medicine for this type of rheumatism, another medicine highly appreciated by body was Rhamnus californicum. Please open. Okay. Rhamnus. Inflammatory rheumatism. Inflammatory rheumatism. Yes, they appreciate like anything. Now, so many things we have to go through. So many things we have to apply. Until and unless we apply, you will not be able to understand the beauty of this type of application of the clinical part. Now, let us see another medicine that even how little we know regarding some common medicine or we rarely apply. That I'm telling we definitely some of you know or some you may apply. Anybody have to select one medicine for the inflammatory abscess or the inflammation of the rectum. First medicine should be think of Rastrol. Rastrol. Okay, very good. Because please open those who are the younger generation, those who have not new. Please open Boric materia medica. I think it acts better than any antibiotic within 24 hours, if you prescribe in CM potency or 10M potency every 2 hourly or 3 hourly, it can abort that inflammatory process. Is it written in there? Please approach it question. Yes. Now, doctors, now we will have something. What is it? Can you tell me, doctors, now this abscess has already formed. Either the structure has not come, it acts properly, but now recurrent abscess is there. That is fistula is going on. Maybe it is outer part or inner part of the rectum. Okay. And what would the medicine prescribe you are thinking? That is cytisia, fluoric acid, is it not? So many medicines are there. But if you go through Kane's repertory, near rectum, inward or outward, whatever it is, abscess, inward and outward, both are only one medicine will cover. আচ্ছা এটা তো পিওনি অফিশিয়ালিস আচ্ছা ঠিক আছে that is also fallacy. Dear doctors, now change the name, make it abscess, make it boil. Yeah, if you make it boil, then you will see that how a common medicine we are not using for rectal pathology. Only medicine, only medicine inside, outside posticum. Recurrent attack যখনই বসে থাকছি না pathology higher potential and repeated growth. Single nearby stools are there. There is every possibility of multiple pathological infection. So for this reason, either pyrogen or bacillinum or streptococcinum intercurrent with posticum. So that is the beauty of application of knowledge from your repertory. Near rectum, inside rectum. Now, why I am telling that smaller medicine? No medicine is small, no medicine is big. Now I will discuss a very small medicine, even it is in bodic materia medica. Melanoma. Very difficult medical condition, is it not? Extremely difficult to handle. And generally, it starts with a small plaque point, either on the toe, anywhere, upper extremity or lower extremity, anywhere, that gradually it ascending upward, and then ultimately, very difficult and very, not only progressive, result is very poor. No chemotherapy can cure this melanoma. But I think we have a medicine. If we know materia medica, this medicine has superficial abrasion. Okay. Leading to what I am telling, ecchymosis. It is quite common. Anticonception generally prescribed ecchymosis, arnica, lidampa. If lidampa fails, then that is surgery when it becomes virile. This way. But this medicine is telling, so plaque spot, and in materia medica it is written, that is that time in that language, Latin word, that give proper importance to the black point after injury. Black blood means poison, and it ultimately leads to cancer. In that way, that time there is a Paracelsus and others. So this is a plant. And I have tried my level best to go through different materia medica, K, Allen, Mori, but nothing perfect picture was there. Sassafras. আছে কি স্বতন্ত্র আছে স্বতন্ত্র ছবি occasionally and only from mind generality general to skin every symptoms is there only in one materia medica, that is the jar materia medica, jar repertory.
Joint codex. এখানে এখানে শুধু প্রপার দিয়েছি approving আছে যে proof করেছিল চিন্তাভাবনা বা
ওই পর্যন্তই I have tried my level best and ultimately when I go through the books, the jar, please go through jar's writing. There you will get my goodness. So omitted by Ken, omitted by Herring, omitted by Nar, but jar. He wrote, illustrated this case. And remember, whenever any melanoma has started with injury, before giving arnica or lachesis, or even if lachesis symptom is there, we definitely will be prescribed. But until and unless other indications of any common polycrest drug is there, think of this medicine. And please today night you go through Jar's writing.
চারের
Now, again, doctor, so Rastrax we know that regarding that the rectal polyp. How much we can prescribe Rastrax in case of diarrhea? It happened in my clinic and we prescribe Rastrax. Two symptoms are there because it is time is too short. Doctor, in your clinic, just suppose a girl of 19 years old or 20 years old, 30 years old, whatever it is, a girl, Sada Prasad? Sada Prasad?
দেখছি চারের রাইটিং দেখতে হবে
এখানে পাচ্ছি না। আচ্ছা, ঠিক আছে। Now, in your clinic, a girl, remember, a teenager, or whatever it is, or a boy, but very rarely you will get that sitting in this posture. Yes, because instantly we describe the medicine. देखो, hanging down ऐसा है ना? But I don't know whether I can able to raise my legs. This is ठीक है. In your clinic, is it sitting in this? देखो, hanging down aggravates urgency for stool. Against the and মানে involuntary stool will develop. We have seen it in our clinic. Rarely you will get, but if you get it, breakdown.
ডায়রিয়া and hanging
Urgency, na? And involuntary stool, if you hang your leg, automatically your chair will be spoiled.
নাড়ে আছে নাড়ে আছে আসল সিম্পটমটা বুঝলেন সাংঘাতিক সিম্পটম তো স্যার ক্রনিক আবার
Chronic,
ক্রনিক সিঙ্গেল
single.
stool arching peak brought on by hanging down stool involuntary if not at once responded
Yellow हो जाएगा.
মানে সঙ্গে
Instantly
সঙ্গে
yellow हो जाएगा.
সঙ্গে সঙ্গে
সঙ্গে সঙ্গে পাটাকে তুলে নিচ্ছিলেন। আমার ক্লিনিকে এটা হয়েছে। Rastrax has another peculiar symptoms. আজকাল তো যোগা করার না আমাদের গভর্নমেন্টের আন্ডারে সমস্ত যোগা ডে কত তারিখ থাকে জানো? Now, a Rastrax pain in abdomen only ameliorated by lying on back and keeping elevating the leg upward. ওটা বিপরীত করণী মুদ্রা নাকি? দেখো, not longitudinally.
পাটাকে শুইয়ে দিয়ে পাটাকে উঁচু করে উপরের দিকে রেখে দিয়েছে। The only way gastroc pain better by this lying on back. leg
abdomen keep lying back.
হ্যাঁ lying back lying on back তার সঙ্গে lying on back প্লাস লেগটাকে তুলে দিচ্ছে। খুব সম্ভবত কারেন্সি পেপারের কারেন্সি খুব সম্ভবত হ্যাঁ অথবা ওকে আমার হ্যাঁ ঠিক আছে ছেড়ে দাও আমি দেখি তো আমার খাতায় যখন লেখা আছে তখন আমি এটা সারিয়েছি বলে এই জন্য মনে হচ্ছে হ্যাঁ হ্যাঁ
কোনটা কিরকম
একটা অবশ্যই আছে
পিছনে স্টুডেন্ট কেউ পড়ে
পিছনে হ্যাঁ
Undefined.
হ্যাঁ
Lying better on back with legs elevated vertically.
না রে স্যার না রে সিঙ্গেল ট্র্যাক রাস্তা 90 ডিগ্রি
Legs elevated vertically. নারের abdomen chapter. আপনি দুটো keyword দিয়েছেন। থাকতে হবে না। Abdomen আর
এটা once you get this patient
abdomen
হ্যাঁ
elevating
once you get this
elevated
patient হ্যাঁ
elevated abdomen আর elevated দিন না দিন
ওকে ঠিক আছে
না ওই যে স্যার হ্যাঁ
আচ্ছা ঠিক আছে we are praising nerve now I will praise chin okay but no symptom in nerve one of the neglected medicine in gynecological problems those who are handling lots of that is among the female remedies it is one of the medicine but we rarely use this medicine the name of the medicine is upion huh? misplaced displaced antiverted retroverted so many symptoms are there along with that with this uterine problem very good concomitant of this medicine is there patient or the lady or the woman or the mother and try to lean on the chair to get the support he or she cannot sit in this way always desire to get a support leaning on the chair leaning back on the chair boric medica okay but sorry to say there is no mental symptoms of boric in boric huh? but how anxiety prone this woman is you cannot be if you go through the mental aspect if you go through the dream aspect especially dream দেখো driven by oxen সাড়ে তারা করছে falling from height সুজা dreams of naked person dreams of drowning dreams that child is fallen into water dreams of falling in abyss মানে অনেক গভীরে অতল জলে চলে যাচ্ছে প্লিজ ওপেন কেটস ড্রিম চ্যাপ্টার in upion dream chapter all dreams
Dream anxious,
Yeah.
dream anxious, dreams confused, dreams disease, dreams falling off, dreams into abyss. I dream falling into water, dream ghost specters, main naked, pursuit of being oxen, and dreams unremembered, dreams water falling into
how much anxiety and even sexual related symptoms. Naked person is changing, oxen and ox, that is a symbolically male. Okay, so think of that how anxious dreams are there. Now open not repertory. Most probably you will not get a single dream. Right. Okay. So by this way, my beloved doctors, those who are really doing third year, I have no first year, second year, because I have not yet able to cross the first year of DMH. No. This is my understanding that materia medica is really a ocean. And what type of patient you will handle, that will lead you to know more and more regarding that particular symptoms or particular disease. Next, let us compare in another way. Doctor, especially the student, let us say, we have knacks. What is the peculiarity of knacks cough? Not from front benches, last benches. Tell me no. Let me know. Hmm? Any idea? अरे at least तो ineffectual urging with cough ये तो बोलो हाँ देखो dry cough midnight onwards like arsenic album midnight onwards up to 3 a.m. or 4 p.m. midnight to 3 to 4 a.m. dry cough coughing or midnight onwards cough till awake and cough aggravates on lying on back like arsenic album and better by lying on sidewise, either right side or left side. देखो James repertory. Cough, dry cough, नाक से होता cough, नाक से कांपे जाओ. Cough dry, midnight onwards. ওপরে repertory click করে click করিয়ে okay. I have done that. It is always one of our time passes too quickly. Huh?
Half night, midnight after day.
Huh? Cough aggravation lying down, back. Cough better by lying on sidewise, left side or right side.
3 years पूरे
Huh?
acid aggravation. Forms of dead aggravation. Only that. We have put aggravation.
Everything. I remember cough, naxomy cough. All symptoms it's aggravate during morning. Opening morning. Are all symptoms ameliorates after sunset. नाक बंद सुबह में ठीक है रात में बंद हो जाता है झापी बंद naxomy cough. Morning aggravation. All symptoms aggravates. Anyway, I think कितना टाइम हो गया अच्छा 2 घंटा हो गया कब तक है 1 घंटा है 1.5 घंटा है ओके अच्छा फाइल स्टेक फॉर আচ্ছা ঠিক আছে, দুটো নতুন প্ল্যাটফর্ম। আচ্ছা, most controversial medicine, doctor, in our materia medica regarding aggravation amelioration. I'm telling a peculiar drugs, but if you understand this medicine, you will be able to cure lots of patients. It is a polycracy, but we are not making it polycracy. Let me know, doctors, at least 3-4 symptoms of conium maculatum. হ্যাঁ, আচ্ছা ঠিক আছে। জ্বরের ভালো মেডিসিন হচ্ছে প্যারাসিটামল। হ্যাঁ, প্যারাসিটামল সুগার ফলের সঙ্গে মিশিয়ে দিলে কি হলো? পুরো টাইট হয়ে গেল না? হ্যাঁ, ঘুরিয়ে ঘুরিয়ে একটা শতমারি ভবেদ বৈদ্য সহস্রমারি চিকিৎসক। শতবার যে মর্দন করে সে হচ্ছে বৈদ্য, হ্যাঁ, আর যে সহস্রবার যে মর্দন করে সে হচ্ছে চিকিৎসক। আর হোমিওপ্যাথি আরেকটু মর্দন করে দেওয়ার পরে 30 মিনিট হয়ে যাবে প্যারাসিটামল। সেটা তো পয়েন্ট। চাটা খাইয়ে নাও, চা খাওয়ার বলার সঙ্গে একসঙ্গে হবে না। ঠিক আছে, সোনিয়াম মেকুলেটাম। দেখো ডক্টর, if you really analyze this medicine, most controversial materia medica like ignitia is conium maculatum. It has modality, মানে better in the dark, aggravation dark, better light, aggravation light, better under sun, aggravation sun. So many symptoms are there. Just like photophobia, na? Photophobia without conjunctivitis. Acha, vertigo, closure aggravation, our opening amelioration. So many symptoms are there, most contradictory symptoms. Now I am giving some good clue. Doctor, can you prescribe, because it is really today's medicine, conium maculatum, especially among the children nowadays. Because conium extremely religious and extremely sex mania. Both. If you go through the repertorial analysis, you will get both symptoms simultaneously. Socrates. So, in most of the cases, in conium maculatum, very rarely you can prescribe conium maculatum only on 3-4 symptoms, apart from this mental aspect. Because milk causes distension abdomen. Gates repertory, only medicine is conium maculatum. I am giving because that will give a good clue that how we can do it. Distension of abdomen, bloated abdomen. Now, because we know sexual suppression is equal to conium. তেল খতম পয়সা খতম, আর ব্যারিয়ার কিছু আমাদের মানে কোনিয়াম সম্পর্কে খুব একটা ধারণা খুব একটা নেই। or hardness, mummy hardness, mammary gland hardness before menstruation. Now, if you open mammary gland, the itching of the nipples or itching of the mammary gland, highest rubric is conium maculatum. Hence repertory. Itching. I am giving some examples of that. Itching. Yes. Itching mammary. Conium. Highest.
conium third grade
না, কোথায়? জানি না, বলতে পারবো না।
chest itching, hammy, nipples.
হ্যাঁ 15টা। আচ্ছা ঠিক আছে ম্যাম মিডিয়াও আছে, হ্যাঁ ছেড়ে দাও, অত বলতে পারবো না, যেটা আমি বলছি সেটা ভালো করে শুনুন। কোনিয়াম মেকুলেটাম ডক্টরস, এটা কেন বলছি? জেনারেলি ক্যান প্রেসক্রাইব কোনিয়াম মেকুলেটাম। Can we prescribe conium maculatum in acute pancreatitis? In acute pancreatitis, I will show the book from book that how little we know regarding conium maculatum. Because pancreatitis is one of the disease where homeopaths should win the laurel. Because every month, every 2 months hospitalized for 30 times, 40 times, patients have come from Delhi, Madras, in Calcutta. And successfully we have controlled that last 3 years only once admitted in hospital. But you have to know that what are the medicine we should be think of for this chronic pancreatitis. One of the medicine is conium maculatum. Definitely from our knowledge we are telling that pancreas is hard, swollen. That is quite common. History of injury, maybe arnica, belly spur. But what is the clear-cut indication or accompanying symptom or onset symptoms of conium maculatum in case of pancreatitis? Suddenly, Dr. Saab, midnight में ये क्या हुआ था ना? अचानक I started vomiting and diarrhea, like arsenical, vomiting and diarrhea. तो क्या हुआ था? But vomiting में कुछ नहीं हुआ था, only पानी आया. No fecal matter or no food particles with either vomiting or stool. कौन किताब में लिखा है? That is the only indication in chronic pancreatitis. Sudden onset of the pain, vomiting, purging, but nothing. Defecation or vomiting, only water is coming. No food particles. And he has compared with another medicine, that this medicine also is vomiting and purging, but it starts at 3 or 4 a.m. That was in midnight. And in this medicine, it was 3 or 4 p.m. onwards, bitter taste and other things are there. And both the medicine has intolerance of milk. Milk causes distension, and this medicine has even slightest drop of milk causes distension or uneasiness. He is comparing these two medicines. Okay, please open Lilienthal, conium in pancreatitis. আছে?
ডায়াবেটিস জানছেন ডায়াবেটিস এইটাই ডায়াবেটিস এবার এইখানে কি অবস্থা আছে হ্যাঁ অবস্থা লিখুন ডাউন লিখে দেবো পাবেন বা লিখে দেবো
এবার pancreatitis conium.
capital acute pancreatitis, sudden attacks of vomiting and diarrhea at night, vomiting of white substance consisting of saliva without any admixture of the contents of either stomach or bowels.
Okay,
Trembling of abdomen.
thank you sir. So many things we have to learn. Pancreatitis
The pancreas is Delhi bichromo দিচ্ছে ulceration of duodenum মানে as a result of
concomitant.
আমার বলছে হয়েছে আমি
পড়ার শেষ নেই বাবা, পড়ার শেষ নেই, পড়ার শেষ নেই, সেই জন্য না পড়াই ভালো। Huh? না কম্পেয়ার হচ্ছে কেজি কার্বোনিমালিস 3 to 4 pm your aim aggravation.
Indurated pancreas, profuse, tasteless, thin saliva of sweetish
Sweet
odor,
whiskey.
sensation of coldness apparently rising from abdomen.
এখান থেকে বলা ঠান্ডা in conium coldness only on rectum and in carbonimalis coldness throughout the esophagus, that is and better keeping the hand on abdomen. The coldness disappear as soon as you keep your hand on your abdomen. That is carbonimalis. Okay. হাতের পরে পেটটার পরে হাতটা রাখলেই ঠান্ডা সেন্সেশন কমে যাচ্ছে। What is the cup of carbonimalis? Cup, peculiar cup. I think still I remember one homeopathy doctor came to our clinic. Remember that time some homeopathic conference was going on in Calcutta, and the doctor is from Siliguri. We know that in our clinic, he narrated very nicely mother's case that as soon as mother lie on right side during night, cough aggravates. But during daytime, if she sleeps on right side, no cough. Because cough only on right side lying on during night. Only medicine is carbonimalis. Cough lying right side.
Turning into the right side only.
Turning into the right side ambulance. Aggravates. Only.
Dry night cough lying on right side only one.
Night হবে না. And that lady survived more than 9 months. What she was supposed to die within few days. Anyway, I think, doctor, it is eternal, very difficult to discuss thoroughly or systematic way. Very difficult, because lots of medicine we can discuss one after another. But let me know at least some requests from some my contemporary doctors that few new medicine what you are using in your everyday life, just like a polyclinic. Okay. Just I am giving some hints. Nowadays, normal menstruation is absolutely abnormal. Okay, regular menstruation, it is absolutely abnormal, and abnormal menstruation is nowadays is totally normal. Menstruation either 3 months, 4 months, 6 months, or when it starts, it continues for 21 days. Irregularity of the menstruation is a burning problem for the gynecologist. Lifestyle, diet, night watching, whatever it is, hormonal pills, this and that, everything for deferring menstruation, for puja, for holiday, for different travel, enjoying life. It is a part and parcel at the present moment for these girls. And ultimately they are becoming the victim. Polycystic ovary, polycystic syndrome, whatever it is. And actually I don't know who has given the name polycystic ovary. Every ovary is polycystic. How it become a disease, I don't know. It is absolutely misnomer. And without multiple cysts, how ovary will exist? Or why, how, in which way it will menstruate, only God knows. But remember this type of extreme use of estrogen progesterone combination or estrogen combination producing a lot of problem, including hirsutism, including amenorrhea, menorrhagia, metrorrhagia, And one medicine you have to think, at least every day you have to prescribe. A lady is coming after 7 years, 10 years, 3 years, 4 years OCP. One of the medicine we should think of Aristolochia climatitis, like thyroidinum, Aristolochia climatitis. And remember, if the patient is extremely chilly patient, remember, chilly, extremely chilly patient like Silesia, like Cistus canadensis, like thyroidinum. That is one. This is the medicine which a peculiar amelioration. During menstruation, all symptoms subside. Before menstruation, after menstruation, aggravation. Hmm? During menstruation, as soon as menstruation taking place, that time amelioration is there. Zinca metallicum, lachesis like symptoms are there. Remember, another medicine has this peculiarity, just you have to compare every time, because generally I try to repertorize in my mind. For this reason, I am taking another medicine that which has all symptoms except mental symptoms ameliorates during menstruation is মাসিক হলে আমার সব যেমন মাসিক during মাসিক I develop more rheumatic complaint. It starts before menstruation, but as soon as menstruation started, I develop pain, active resignation. It is not more the flow, more the pain. But here, all symptoms, it ameliorates during menstruation, except mental health. The name of the medicine is alkaloid of actia racemosa is macrotide. Okay, that is the beauty that even alkaloid has just opposite character, opposite modality. We have to know, doctors. More you read, more you will be confused, but no confusion. It happens because macrotide is the only alkaloid, but the medicine is not, is only composition of macrotide. We have other so many things are there, which is creating or making balance or imbalance of other symptoms. So this is menstrual symptoms, menstruation ameliorates. Chilly patient. Next, it is a combination physical symptoms and mental symptoms. Doctor sir, when we are asking the card, what about the emotional aspect? Emotional aspect of your uh, just emotional aspect. Can you describe some things? It is a combination of three medicines. Doctor, one is pulsatilla, another is sepia, and another is arnica. It is a combination of three. Pulsatilla of mental aspect, weeping disposition. Weeps easily. Extremely weeping dispositions, but angry and consolation aggravates. Like natramir and sepia. I do it physically, mentally, desire to be cold, everything, intolerance, fatty food, desire fatty food. So physical symptoms, pulsatilla. Mental aspect, sepia. With any kind of female problems, I'm telling. In Julian's materia medica it is written, all sorts of viral infection of female genitalia, the first line. Julian আছে? Julian এর নিউ রেমেডি নেই? Julian নেই? হ্যাঁ, just any viral infection of the female uterus, female organs, first medicine should be think of Aristolochia dermatitis with history of lots of medication and combination of arnica, combination of pulsatilla and sepia mentality. Mentality of this combination, and why I am telling arnica? Why I am telling arnica? It supersedes calendula in abrasion and injury. Number one. Local application দেখা গেছে যে ক্যালেন্ডুলাকে সুপারসিড করে। যদি if you go through the old writings, if you go through. Number one, that bluish sensation, bluish feeling. And another thing, doctors, if you go through the medical history, the Chinese medicine, once upon a time during Second World War, it was banned. It was banned totally in Bulgaria when it was found that lots of women and soldiers and women and others, they suffered from cystitis and terminal stage of kidney diseases. Terminal stage. And they ultimately found the ingredient of the medicine which they consumed that time, it contains maximum Aristolochia clematitis. Okay? And what happened that during cold time, most of the soldiers, they passes the stool every 15 minutes, 30 minutes, 40 minutes. When it was stopped, they automatically suffered. They automatically cured. So from that cystitis, from homeopathic point of view, repeatedly or frequent urination, cystitis with kidney involvement, always think of Aristolochia clematitis. Okay? When soldiers are in the trains, in the cold area, cold aggravation, cold causation like aconite, posticum, dalcamara, rustox, cold first attack followed by cystitis. We have lots of medicine. Dalcamara one of the medicine, aconite one of the medicine, Epigia depends one of the medicine, and Auditorium purpura one of the medicine for female cystitis. But this is the medicine where kidney involvement is there. And I think today, very few people, lady we will get without contraceptive pills. It antidotes adverse effect of the estrogen. And when it is estrogen, then you can do it that acne before menstruation, during menstruation, breast tenderness, heaviness, everything you will get. And please go through two writings. One is Julian's book, another is the first description of the clematis erecta very nicely. Wheat found psyche and substance.
Which one?
Psyche and substance, but I nothing understand from his English because it is a translate from the other language, and the translation is it was Greek to me. Even though it is written in English, it is very difficult to understand because just like our organon, fifth edition by dozen, one sentence means 30 lines. That was the problem.
জুলিয়ানের এখানে এইচএস এর জুলিয়ানের নিয়ে পড়া আছে ফ্রম ডিসট্রিক্ট ওয়াট পড়া
করা আছে।
এটা কি মার্কেট
After menses.
all symptoms evaluation
During menses. During menses, evaluation is a very peculiar symptom. Okay? So, chili, just like lacacy, just like zinc metallicum, we have to differentiate. We have to differentiate all the time. Think in that way, and it is one of the medicine for the injury. Especially if you go through writings, I think granulation ulcer over the chest when discharge like dalcamara, always think of this medicine. Discharge like anything. That is your weeping eczema. It is one of the medicine. But Aristolochia has the dry, burning sensation in eczema and the neck region. Dry and burning, I am adding. That is Aristolochia. But it has a oozing like dalcamara over the tubercular ulceration. And when tubercular ulceration, when it is extremely flat, it is not penetrating, but it is spreading over the skin, then medicine is tubercular ulcer. ডাক্তারবাবু স্কিনে টিবি হয়েছে and it is spreading পদ্ম পাতার মতো আস্তে না লোটাস লিপের মতো স্প্রেড করে যাচ্ছে the name of the medicine is The name of the medicine is Chelidonium. Alan Skinner. देखो Alan Skinner में देखा है with liver symptoms of the tuberculosis.
with hepatic
अच्छा टाइम नहीं ना देखा था tuberculosis.
tubercular diabetes.
So this is one of the medicine. I think try to collect, try to apply. More you apply materia medica of your own, more you will be master of materia medica. But now I think other thing that it will give more enthusiastic idea to become a successful, to become a better student. It's very difficult to be master on materia medica. Because every medicine, every thought process, every book, it has its different understanding according to ability. Not only even the reaction differs. Even if we consume alcohol, reaction differs. Na? In alcohol, as Palford has written very nicely, that alcohol makes England something, English people, French people something. I'm telling the word. Palford की किताब है? देखो ना. देखो ना alcohol. The Benthro and the French, the German, the speaker.
The French region like that. We say this become English gloomy, French gay. যার ভেতরে যাচ্ছিল বেরিয়ে এসেছে
একদম ভাই ওর বই নো না অ্যাকচুয়ালি না দেখো মোস্ট কে বলেগা মোস্ট লাইং দ্যাট ইজ মিথ্যা কথা না ইট হ্যাপেন্স when you are touching Gita or Quran in যাহা বলিব সত্য বলিব in আদালত and telling everything lie and most truthful word we are taking after we are delivering lecture after alcohol সত্যি কথাটা বলে মদ খাওয়ার পরে আর মিথ্যা কথাটা বলে কোরআন এবং বাইবেল বা তোমার গীতা হাতে নিয়ে দ্যাট ইজ দ্য ফ্যালাসি আমরা হোমিওপ্যাথি পড়তে এসেছি সেইটাই তো আসছে আর যত ক্লিনিকে ভিড় হয় তত ভাবি যে এত বোকা আছে ইন্ডিয়াতে যে হোমিওপ্যাথি ওষুধ খেতে এসেছে হ্যাঁ এত সেন্সাস সেই মানে বোকামির তো সেন্সাস করা উচিত না নেক্সট আর একটা মেডিসিন কে বলেছিলে তুমি অনিন্দ কি মেডিসিন
Cyclophosphamide.
সামাইডিয়া
ও Apium granulosa.
হ্যাপিয়াম এইটা দিয়ে শেষ করি না অনেক এত বেশি পড়লে না ভালো লাগবে না অ্যাপিয়াম গ্রাভিলেন্স medicine for indigestion যদি অ্যাসিডিটি হার্টবার্ন ফ্লাটুলেন্স ডিসপেপসিয়া unbelievable result you will get if you know how to prescribe Apium gravidae. In body, some symptoms are there. Mental aspect, it is also cheap patient, but the can endure night watching, cannot be fatigued. Night watching and body of fatigue minor. So just like acid fluoricum and opposite of magnesia carbonicum. Magnesia carb, more fatigue after awakening. More. And here is just our thing. If I sleep for 1 hour, 2 hours, 3 hours, that is enough. Short sleep is enough for acid flow, for medica, for Apium. Okay? Acidity, heartburn, flatulence, dyspepsia, number 1. Number 2, chilliness. Just like phosphorus, everything desire cold. But phosphorus generally desire to lie on right side. This patient prefers to lie on left side, especially during menstrual pain. Desire to lie on left side and crossing the limbs over the abdomen. Either lie colosine bent forward or desire to lie on left side and crossing the leg. That is Apium. In Apium, Borik has written very nicely that in bracket, I think first paragraph, that is growing pain, growing pain, growing pain, and most obstinate retention of urine. Second line, most probably.
Obstinate retention of urine. Second line.
Second line. এখনো ভুলিনি, এখন কিছুদিনের মধ্যেই ভুলে যাবো, বয়স হয়ে গেছে তো, করার নেই। নেক্সট, it is the medicine for the urticaria. Urticaria with shivering or chilliness. দেখো, chilliness, right? Urticaria. And peculiar thing, দেখো, urticaria, দেখো, as soon as touches, if you touch the place, it will stop the urticaria, it will appear in another place. যেমন establishing এর মতো, চুলকে এখানে চুলকে দিলাম, after itching, it changes its location. Maybe somewhere else, or I am wrong. ভুলে যাচ্ছি, তবে যাই হোক, আর্টিকেরিয়া এটা খুব ভালো মেডিসিন, আর্টিকেরিয়া। আর্টিকেরিয়া শিভারিং, 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 মোস্ট প্রবলি সেইনের মধ্যে এখানে নেই এটা।
আর্টিকেরিয়া শাটারিং।
শাটারিং, হ্যাঁ। এইরকম আর একটা কোন মেডিসিন আছে, এরকম ডাক্তারবাবু যখনই আর্টিকেরিয়া হয় তখন মেডিসিন, it appears suddenly. It is written, urticaria appears and disappears suddenly with antibiotics. Good, very good. Okay. তারপরে ইনসমনিয়া আছে, স্যাডনেস আছে, ওগুলো তোমাদের তো কি করতে হবে না? হ্যাঁ, more you read, more you apply, then you will get more clinical symptoms from this smaller medicine. Nothing is smaller, nothing.
Sir, এখানে একটা সিগন্যাল যে eating does not help sleep.
আচ্ছা, eating ml আছে।
Eating ameliorate আছে, eating ameliorate আছে, টিচার, হ্যাঁ, এগুলো দেখো, in seminar it is very difficult to explain everything. To explain one medicine, na, we can explain. That is the, I should not say, in different places, I have traveled, I have observed one medicine in a day, two medicine in a day. And more you analyze, more you fathoming, and more you gradually it is become from your supracortical, 6 feet away from above of your brain. Fathoming is something else, but what you have to take in reality, that is very small. Very small. And honestly speaking, nowadays we are applying the methodology 100 pages, 120 pages, 150 pages case taking form. From our time also we have seen. But have you observed Master Herring's writing? Have you observed Kane's case analysis, case taking? Have you observed Leafy's writings? Bonnie Notion's writings? 3, 4, 5, 6 or the 10 lines maximum. They observed maximum, but wrote very small. That which is the gist, which is really able to identify the inner aspect or the core pathology or core picture. Nowadays, I know a lot of teachers are taking 60, 70 rubrics to find out the medicine. I know. I'm not mentioning. Yes, they are trying the level based in which way they are learned. But 3, 4 symptoms also. So in which way you will travel, that's up to you. And in which way totally it will come, that is also very difficult, because sometimes it may take 3 days, 4 days or 5 sitting. After that, we may come to the conclusion of a medicine. And sometimes it is very easy. So it depends person to person or the disease or the person what you are handling. And not only that, I think doctors, especially those who are practicing in practice or student or the doctor already, I think you have some confusion regarding this single medicine. Because nowadays single medicine, complementary medicine, And especially in western part of the Mumbai, generally, apparently, I believe what they are telling that single medicine, constitutional medicine, the same thing when you are in womb up to the tomb, the same medicine you have to prescribe. Okay, no need of complementary medicine, no need of antidote, no need of acute medicine. Fixed constitution. And so that is A means till death. Whether you have some fever, injury, death, no medicine, that is your constitution. I don't know from where this has come from our materia medica at the present moment. It is something unique, single medicine. But have you anybody have gone through the writings of the Rima Headley, that last days of Master Henneman? If you go through, then you will see that even Master Henneman, how many times he has experienced with this potency and the name of the medicine. Just go through his Bonnie Innocent's writing. Bonnie Innocent has wrote very nicely that at the present moment 3 miasms are there. But definitely within decades or some times ahead, we are thinking that other miasms are coming. But if you say this to any person, those who are mastered of organon, I believe in Sora syphilis and type. Okay. But this type of obstinacy or the headstrong mentality, I think it hinders the progress. Whether they are right or wrong, I have nothing to say because I have no idea regarding organs. But if we really go through materia medica and case taking properly on organon basis, automatically miasm will come. And most of the anti-miasmatic medicine is 3-dimensional. It is anti-sodic, anti-syphilitic, anti-psychotic. And in Suriname chapter, indicated medicine fails in gonorrhea. Is it not? What more I can give? Okay. First line of Allen Skinner, Menstrual, sodic symptoms of the neurological complaint. So I think we have misunderstood this single medicine. And another thing, let me discuss one thing. Master Monin Hossain was suffering from ileitis. I think that was the last story I am telling, not a story, it happens. And that time, anyone was not there. And other doctors, they were treating, and 9 days, 8 days passed. There was continuous pain in this place. And one of the doctor was Agassi. That time, that the multi-drug therapy, who was there? No. And other 3-4 doctors are there. And ultimately, Moni Hossain observed a very peculiar thing that he is perspiring on the uncovered part on 7th day or 8th day. And he prescribed puja on himself, uncovered part. And within 5 minutes, the patient, he is feeling better. And he wrote letter to the Master Henneman that this is my position. In that case taking I have done. And after 18th day, Master Henneman answering, because he was far away that time by the horse riding, you have selected the perfect medicine, but going through your case taking, I have observed that these medicines should be followed by lycopodium, followed by corium. And Master Monin Hossain is replying, yes, I have done after 7 days lycopodium, then after 7 days corium. This is the relationship between teacher and the disciple, and how even the case taking is showing that is these group of symptoms will not be controlled with lycopodium or complementary medicine with lycopodium there. Think of in that way that at the present moment, lots of medication with the people, multivitamin, anti-cholesterol, hypertension, sleep-induced medicine, H2 blocker, beta blocker, so many blocker. And do you expect that with one medicine, it will cover all the symptoms which is appeared through your drug toxicity? Or is it possible that all the blockers, channels, calcium blockers, H2 blockers we are giving, so most probably it is better to start with anacardium, that is suppression of the flow. Like this, so many things you have to do with doctors. So I think symptoms is coming. Take this, give the medicine, wait and watch. Till new symptoms are coming, no medicine. But if new symptoms are coming or symptoms is changing, definitely we should think of other group of medicine. This is my concept. Thank you all for patience hearing. But hopefully, the clinical medicine is something else, and I believe that you will be really will be a best possible clinician to help the human suffering. Thank you all.
Thank you, sir, for such a revelatory and impactful session. We have truly taken us beyond the boundaries of routine practice and introduced us to an entire landscape of new possibilities. Your detailed case examples, materia medica correlation, philosophical clarity have truly shown us how healing can happen when we dare to look beyond the common. Now, we would like to invite our dignitaries, HODs to come on the dais and felicitate Dr. Sunirmal Sarkar sir with flower bouquet and Auditorium. I would like to invite our HODs, Professor Dr. Rajat Kumar Pal sir, Professor Dr. Sakwat Hossain sir, Dr. Mohan Giri sir, and all other dignitaries, our PGC sir, Dr. Soma Bhattacharya, to come on the dais, Dr. Pindu Denda, Dr. Arpita ma'am, and all other faculty members. Please come on the dais and felicitate our sir. Anita sir, Shashank sir, Amita sir, a token of appreciation from me and the family.
Yellow is sir. Yellow is কি করবে স্যার আপনি বলতে নেই
All the PGTs are requested to come on the dais for a photo session. Be it quick, guys.
এই অভিষেক অভিষেক অ্যানাউন্স করেছে আমার গাড়ির চাবিটা কোথায় পড়েছে একটু যদি কেউ পায় হ্যাঁ স্যার এই আমাদের টিচারদের সঙ্গে একটা দাঁড়ানো স্যার আপনি একটু বসুন 1 মিনিট আর 1 মিনিট আর কেউ বাকি আছে সব তুলেছে দেখো আমার ওখানে গাড়ির চাবিটা নেই তো
এই ছবিগুলো তোমার করেই আছে
না বই দুটো আমার
শেয়ার করে দিও তো এটা তো ये सिर्फ आपका फोन में ही है